Senate Republicans abandoned their latest effort to repeal former President Barack Obama's Affordable Care Act on Tuesday after failing to secure sufficient support from fellow Republicans. Trump said there would be another vote on health care in the first few months of 2018 and he would work with Democrats to make the effort more bipartisan. Democrats strongly oppose repealing and replacing Obama's signature domestic policy achievement. "I am going to meet with Democrats and I will see if I can get a health care plan that's even better," Trump said. "So I will negotiate with Democrats, but from the Republican standpoint, we have the votes. We'll vote in January, February, or March." Republicans control the Senate by a 52-48 margin. The bill's sponsors vowed to try again but face steeper odds after Saturday, when special rules expire that allow them to pass health care legislation without Democratic support. Trump told reporters that one of the votes they needed was of a senator who was in the hospital, Senator Thad Cochran of Mississippi. Cochran's office said the senator was not in the hospital but was recovering after being treated for a urological issue. Republican Senators John McCain, Susan Collins, and Rand Paul opposed the bill. Across state lines, Paul has encouraged Trump to legalize nationwide health associations, which he says would allow people to get group health insurance across state lines. Trump said he was working on a measure to do that. "I am considering an executive order on associations, and that will take care of a tremendous number of people with regard to health care, and I'll probably be signing a very major executive order where people can go out, cross state lines, do lots of things and buy their own health care," Trump said. "I think Rand will be there for us," Trump told reporters. UCLA professor Mark Peterson expressed doubt that insurance prices would be reduced by selling across state lines because insurers would still be subject to ASAI regulations requiring coverage of hospital care, prescription drugs, pregnancy and childbirth needs and mental health services. "What drives cost of care is the cost of medical care. If I'm in California, which is an expensive medical care state, and I buy my insurance from Delaware, which is not, I'm still going to doctors and hospitals that are very expensive and the insurance plan is either going to cover that or not," he said. Congressional leaders said on Tuesday they were moving on to tax reform legislation. But the Senate's number 2 Republican, John Cornyn, said on Wednesday that lawmakers would continue to work on health care. He said the authors of the most recent Obamacare repeal bill, Senators Lindsey Graham and Bill Cassidy, hope to increase support for their proposal. Republican Senator Lamar Alexander and Democrat Patty Murray resumed their bipartisan talks on Wednesday seeking a deal to help stabilize health insurance markets, a Murray spokeswoman said. She had no details. Alexander chairs the Senate Health Committee and Murray is the panel's top Democrat.